Hello everyone, myself Parimala Ramu. Today we are here to present the assessment presentation on a critical management in a global context assignment. So we are working on a World Economic Forum 2018 assignment. We have taken a topic of the new era for a global health. Uh, in this panel, there are four speakers who is mainly talking about the healthcare center. And the first person is William Henry Gates, who is a co-chairperson of the Melinda Gates Foundation. We don't need much information about him, probably everyone knows about him. And the second speaker is Atul Gawande, he is the executive director and he is also a surgeon and a research executive in a Bhagam Women's Hospital. And the third speaker is Jayashree K. Iyer, she is an executive director to a medicine foundation. And the fourth panelist is Arif M. Naqvi, who is a founder and a group chief executive of Abraj Group. Well, we talk about the introduction about the World Economy Forum, which held in Davos, Switzerland. And the panelists actually mainly focus about the healthcare center, which normally produce the medicines globally. The current condition of the situations of the public is like people are lacking behind the medicines, lacking behind of the healthcares, there is no proper medications people are getting, then people are suffering from communicable diseases and also non-communicable diseases which is highly impacting to the society. And the main aim of this conference was also focus on the medicines affordability to the people who are actually facing a problem on getting a treatment for the cancer, HIV, and major diseases for the patients. And due to this causes, the death rate is actually increasing on a higher range. So in this panel, they also focus about the healthcare, which is implementing the death rate by day-to-day activities. This project is also aiming about the consideration of a BPL and APL card users which implement the health issues in offering a good service to the poor people in developing countries, like offering a cheap cost rate in the medicines, offering free services to getting hospitalities, etc. They also deliver a free service and also an improvement to the people who is home-based patient and a long-term patients. And here we come across the main functionalities of this panel, which normally focus about the policies, informatics, payments, tools, care delivery modes. And majorly policies consider about the regulations which normally support the people in learning and continuous improvement. And the payments is actually a rather improvement of volume, customer care services, and how the implementation of the capital investment takes place. And informatics is about the permission of the analysis, sharing of health outcomes, what are the product and services research taking place in that informatics. Tools, actually they have an analysis of data, like benchmarking a clinical decisions, what are the people actually focusing on productivity, analysis, risk assessments, etc. In a care delivery model, people focus on better access to the care, how the improvement takes place in the health innovations, what are the measures to improve the performance of the healthcare, and how the people are getting benefited with this. Now my friend Adil Khan is going to present the first speaker slide.
Okay, hello guys. I'm going to be talking about the first speaker, Bill Gates. So, as you've got the idea of the topic, the video actually is focused at the progress in research and innovation in the healthcare system, and it talks about the introduction of the private sector investments and its importance, and then also talks about demonstrating the eradication of non-communicable diseases and many other stuff. But I'm going to be talking about premature deaths only. So pretty much Bill Gates actually mentions that premature death can be reduced from 5% to 2.5%. 5% is the current value now, but he's talking that it can be reduced to 2.5% in the upcoming 15 years. And then he also talks about the affordability costs. He says India and China has to come across some new kinds of research and innovations to achieve such target, rather than following the United States procedure, who are using $10,000 per citizen in the healthcare system. So, as I mentioned about the eradication of non-communicable diseases, according to a World Health Organization's report of global health estimates in 2016, almost 56.9 million deaths were reported, amongst which a very high percentage of deaths were caused by the non-communicable diseases, like ischemic heart diseases or heart strokes, and these two diseases constitutes almost 15.2 million deaths in 2016. So even though Gates mentions that the premature deaths can be reduced to 2.5%, and it has fallen from 10% in 2000 to 5% in 2018, it has been evidenced from that report that I just mentioned that the rate of non-communicable diseases has increased from a low value in 2000 to a very high value, which makes 71% of death causes in 2016, as according to the report. And so it is somehow appreciable that the percentage of premature deaths has fallen to 5%, but it seems like very less attention is given to the eradication of non-communicable diseases. And then comes the point of affordability costs. So high-income countries have advantage of gathering information about the causes of the deaths, because they have a system through which they are able to collect the information. But the low income and the middle income countries, in contrast, cannot do that because they do not have such kind of systems, so they cannot collect the information required. So it would create a problem for estimating incomplete data. So the proposition is that the health policies and the strategies regarding the healthcare system would have to be more clear and structured, and a proper implementation of strategic policies regarding the reduction of premature deaths should be stated. It should be more clear, and there is a lot more work required in this sector. And then the next point that Bill Gates mentions is that he mentions the point of training medical professionals, and he says that countries like India should come up with a new set of standards of assessing their medical professionals or their medical qualification requirements, but rather than following the US's or the British standards. So let us assume if even India follows the procedure of introducing a new set of complex standard system for qualification assessment as proposed by Bill, there is a probability that there will be a huge resistance to this change from the previous health management system in India. As considering the political infrastructure of India, there will be a huge resistance, and there will be problems and issues regarding that. And secondly, if even India succeeded to achieve the target of creating their own standardized qualification framework for the medical professional assessment, it would be the question rises that would it be as effective as the United States or the British standards? So the solution for that would be the point is kind of valid, that establishing a new standard is necessary, but there should be a strategic planning in a systematic approach, so that the issues and the problems that may arise with this shift can be controlled, and the new modern healthcare system can be implemented in a more effective way. That's it. And the second speaker will be the views about the second speaker will be presented by my friend Parimala. Please.
Thank you. Hello, myself Parimala. I'm talking about the second speaker, who is Atul Kwande, who is one of our founder and the research panelist, second panelist. He actually talks about the solution of reduction of our death rate at the early age. During the age of 70, the people are more prone to death, actually, due to the medications, due to the health sector, due to the other problems approached in a current range. He also talks about the death rate actually in 70s would reduce about 25% more than it compared in the previous stages. At the death rate where it looks, Atul assumes the approach of a certain structural policies which mainly focusing on the smoking, tobacco control, traffic safety policies, addressing issues of the air and water pollution, and the maternal issues. When you come across looking at the tobacco control or a smoking control, generally people tend to have a more smoking habits, which is currently in the past few decades, from past 500 years initially when it started, there are thousands of people who are addicted to the smoking. And it has been said that 1.3 billion users are killed, more than 14,500 people every day by doing smoking. And well, when we talk about the tobacco taxation, actually they have come across a strategic plan about approaching and reduction of the tobacco control. This taxation is implemented effectively for policies regarding high price in tobacco placed. And the implementation about all these policies about the tobacco control, he come across safety measures of using a tobacco, and also he says that this tobacco should be eradicated completely in the future coming eras. And he mainly focus about the traffic rules, traffic control, which says about the death rate actually increase even with this compared to the developed countries. In developing countries it is very high, as the rules and regulations which is not being highly managed or highly designed or well designed in the developing countries. Because of the very low laws follows, people normally don't care about the policies, and the drinking and driving during the night time, they don't wear the helmets, they normally use more people than the passages used for the people, and they also focus about the speed limit. The youngsters are very crazy about the speed currently. So these are the main reasons actually to cause of the traffic deaths. And we also focus about the air and water pollution, which is actually a major cause in a current era. In India, if you say example, there is a huge range of pollution which is taking place. In India, it's Delhi. Today, in a time, we cannot breathe properly. The air pollution is in such a condition that people wear masks even at the early morning time. At the daytime around 5 o'clock probably, even at the time, people are unable to have a fresh air to breathe. And this is one of the major causes. And water pollution, these sewage waters are completely polluted, and the river water is also completely polluted. There is no fresh water available for the people, and the groundwater level is also decreased due to the global economy era. And towards to the implementation of this, when we look about the tobacco taxation policy is actually encouraged to eradicate the use of tobacco in a future era. And we also need some strict policy and limitations to overcome the tobacco products, and also people has to be more aware about what are the products they are using, and they have to stop using tobacco, which is actually killing them and their family and their friends, because once they start smoking, they are not affected that extent once they smoke, but the person who is inhaling that smoke fog is highly influenced with that, and the death rate is highly for the person who is next to the smoking person. And when it comes to the traffic, they should also take safety measures like wearing helmet, having a proper speed limitations, and the government also has to fix a fixed law that people has to completely follow the rules and regulations which is fixed for them in the developing countries. But when it comes to developed countries, they actually follow moderate laws, so there is not that extent of deaths happening in the due to the traffic in the developed countries compared to the developing countries. And the next slide about the third speaker, my friend gonna continue with.
Thank you for that. The third speaker is Jaisri K. Iyer, and she is the Executive Director of Medicine Foundation, and which is supported by the Bill and Melinda Gates Foundation. She's talking about some points which how to do a smart business. She also mentioned some IT problems which arise in the pharmaceutical industries also, and how to improve the health by providing medicines at that time, and the competition occurs between the different companies. So to encourage a business with the social impact that would be provide and opportunities can be only allied, but you do not sell only a product, but you have to concern with the healthcare and healthcare facilities. The idea of financing the pharmaceutical industries is good. It would be providing medical facilities to all the publics who need it, and however challenges associated with the equity investment. Investors are encouraging to invest their money in the pharmaceutical industries, but they need a surety of that money. So maybe they expect that they give some power or some policies to secure that monies, and every investors want the authorities to make decisions. It may be possible to decision making process are different, and it creates a conflict between the different companies. So how you solve that the problem? But when everybody when everybody talking about everybody, so that is not the solution. They have to come together, sit together, they discuss the points which is arised, and they have to continue with that problem. So there should be clear understanding is needed what the problem arise, and what work on the different aims, and maybe between maybe merge together and work on the same things, and you have to make the best between the two parties. Thank you. And now the next slide is presented by my friend.
Hello friends, my name is Harnik, and I'm going to talk about the fourth speaker, who is Arif M. Naqvi, who is a businessman from Pakistan and has his company named Abraj, and it is based in the United Arab Emirates. And he talks about bringing privatization in the healthcare system, and he has mentioned in this video that without bringing investment, there is no impact. So investment is very necessary to get the results perfectly in the healthcare systems. And talking about, he mentioned in his video that in India they have started some privatization. They have implemented privatization in the healthcare system in the southern parts of the India, and they are getting a better result as a result. But I would like to say that thing is trying to implement has some advantages as well as some disadvantages. And so when talking about bringing privatization in the healthcare system, the firms which are involved in the healthcare system are actually they actually want to have gain more profit through their through their outcomes. And so when the firms involved in the healthcare system, like the private companies, it will be beneficial for the healthcare system. And due to this, the efficiency of the healthcare system will be improved. And also there are certain advantages like the lack of political interference in the healthcare systems. Apart from this, when talking about the short-term use of the government, for example, I would like to say that when there are elections after every certain terms, and every time there is no guarantee that this particular or any specific party is going to come every time. So when whichever party is elected, it does not invest more towards the public healthcare, and they try to run the system in an efficient way. So less emphasis is given to the healthcare systems, and due to that, implementation of privatization in the healthcare system would be beneficial to us. And another one advantage is that due to the involvement of the private firms, they will be more pressurized, as they will be having the more shareholders to do well, perform well in their shares. And so the company will try to maximize their profit by giving excellent services. And also due to they will be having the fear of losing the contract or the any bonding with the firms or the government hospitals or something like that. And due to that, there will be increased competition among the different firms, and due to which the benefit will be going to the public, as they will be getting good quality in the healthcare system. And apart from this, I would like to say that due to there's also one disadvantage, that if any particular firm stays for a long time in the private healthcare system, they can create monopoly, and which will be very disadvantage. It will be very disadvantageous for the people. And after getting the monopoly, they can increase the prices and make the healthcare system more expensive. And so this is the only negative point I think the privatization would be facing. And apart from this, at last I would like to say that whether it's a private company involved in the healthcare system or the government involved in the healthcare system, the governance is the main issue, is the key issue which must be taken care of. And due to that, the healthcare system can be improved further. And now future goals will be discussed by my friends.
What he actually trying to say is that the governmental institutions of healthcare system should be more like private institutions, and they should operate in such a way that the private institutions actually follow their procedure. Okay, so now we are going to talk about the future goals of the healthcare.
providing the health service accessibility throughout the world by increasing the lifespan and creating the new birth life. It's like explaining about the health system, which provide more service and accessibility to the people who are coming from a poor background or from a developing countries. And in developing countries like Africa and government, and also it includes India and China country, which is like lacking behind with the prominence is given to the people who are backward classes, and they also has to give some insurance to the people who are suffering from severe ills like cancers, HIV and other issues. And this research also innovate a few contribution about the processing of operating the systems like problems which majorly comes in the developing countries.
I would like to add to that. You see, I think there should be a sense of international responsibility rather than just letting the poor countries or the low income or the middle income countries follow the procedure by their own. There should be a sense of international responsibility, a get together kind of platform, that all of these issues are not just related to specific countries or specific regions. It is impacting throughout or whole population of humans and the earthly matter by that. So it should be kind of an international responsibility. That's it. I just wanted to add to that. Please proceed.
And also to sustain more response to giving in the quality of improvement. Most of the government, they only give priorities to the people who are high class, and they give moderate importance to the people who are with the low class. And when it comes to that, probably government could come across a new hospitality which brings with low income investment for the people to get a better treatment, and also a kind of new research and innovation should take place which actually help the people who are having severe issues of health, and giving a free medicines would also help them in a lot of way. And providing a staff quality training to the staffs actually. It's like when it comes to a government company, government organization, the staffs are least bothered in caring of people, and they give less time in caring the people. When it comes to a private company, they give more focus and they give more priority in caring of people. So probably we could say that improvement in quality training to the staff would highly increase the research and implementation in a country. And the genetic research in the regulating the current market provide an option to how quick the medicines can help the people to survive. Recently, there is a few research which came out, like a duplicate blood, which is highly available in a market, and the recent research which also says about the stem cells, which provide highly beneficial to the people who are actually suffering from a bone marrow diseases and other earthly diseases, which is taken from the stem cells, which help to increase the lifespan of the person. So these are the few future goals which actually we focused on to be implemented in the next coming updates of the
So
healthcare.
in short, we just to end with this statement that we are actually doing well. We are achieving something, but we should also you see that the problem is that we are actually having some issues and challenges and problems with all these procedures and operations. So there should be more. We should do more with these all of these achievements, and these are just kind of our future goals that we think we should work on.
Work more
Yeah.
on this, and which would help all the country people, both developed and developing countries, which aim
Okay.
a good healthcare
Your friends
to
are-
everyone. And
I forgot to
being-
mention an example of the government policy which was implemented, particularly in the India, in the Gujarat state, where without the involvement of the privatization, the government is running great benefits. I mean, they have improved the healthcare system in a so good way that people are getting benefits, and due to that, the lifestyle and the healthiness of the people have increased, and there are less number of diseases spread among the people, and the people are very happy with that government, and they are trying to bring that government, trying to vote that government in the next time, so that they can they can get the
They can
advantage.
get the advantage.
Okay,
Yeah.
so in short,
And short, we
we really appreciate the
Appreciate
efforts,
the
all
work.
the efforts and all the achievements, but we think more work can be done and should be done and must be
probably
done. Yeah.
these innovations, if it comes to all the country people, it would be more beneficial to everyone to have a very good service of a healthcare in future. And we hope for the best for this
Yeah.
challenges.
Thank you.
Thank you so much.
Bye.